Based in the South Bronx, Health People is an innovative peer training, prevention, and support organization. Its pioneering model of training local people affected by disease to become better health peer educators has empowered countless individuals to take better care of themselves by learning self-care that prevents costly hospitalization and complications.
The mission of Health People is basically to train and empower people from low-income communities to themselves fight chronic disease and AIDS. We recruit peer educators. That means people from the community, either they have a chronic disease or AIDS themselves, or their family do, so they're really interested in and very anxious to try and help out and make the community better. The impact is really based on seeing in your own community, where people are very depressed by this level of chronic disease. They think that no one cares, and the only way it can end up is when people are really sick and they go to the hospital. And seeing someone come in and say, you can avoid getting diabetes, you can bring down your child's asthma attacks. We know AIDS is overwhelming, but you can deal with it. It just has to double the impact of anything.
The South Bronx section of New York is one of the many low-income neighborhoods across America drowning in chronic disease. Healthcare advocates say increasing knowledge and the ability of communities to prevent and fight disease themselves is vital when attacking these sicknesses and health issues.
For example, for asthma, if you teach parents and children, the children's asthma hospitalizations are cut in half. With diabetes, teaching people proper self-care, you prevent terrible things like amputations and endless hospitalizations. And with AIDS, teaching proper self-care, you keep people from, being in and out of the hospital and just being terrible all the time, when actually today they can feel better.
For nearly 2 decades, Health People in the South Bronx has employed a powerful and groundbreaking strategy to help others. By training local residents affected by disease to become peer health educators and teach others prevention and self-care, Health People has seen unprecedented success in fighting the main chronic diseases, AIDS, diabetes, and asthma that overwhelm poor neighborhoods.
We believe in people, and we believe everyone who wants to can become a good health educator. Many of the people we train are addicts in recovery. Most of those we train certainly don't have a college degree and may not have a high school degree. We train people on welfare. We train people who haven't done this before. We train teens, because if the passion is there, we will give the education, and then that will work for the community. And I think, though, if we look at AIDS, which was the only time peer education was really funded across the country, we can see now what we could do for diabetes, and especially you can prevent diabetes completely, and what we could also do for asthma and other chronic diseases.
These peer educators have the local ties and enormous determination needed to bring healthy change to their neighborhoods.
No one can teach you as much about a chronic illness as someone else who's suffering with it and has learned the skills of self-management, as well as has extra information that they can share with their peers. And it's like being in the same boat. People relate in a different way than one person being a professional, the other one being a patient, and all of the complicated relationships that arise when you have that difference in knowledge and power and circumstance.
What I like about being a junior mentor, just being around the kids, just putting smiles on everybody's faces. We're like a family, so we all support each other. We're there for each other. We just love having a good time.
We're very proud of our successes. When we send asthma educators to homes and teach the families proper asthma self-care, the kids' hospitalizations drop by 60%. While we're training diabetes peer educators, their blood sugar goes down an average of 30%, and then they teach other people in the community and they start losing weight and their blood sugar goes down. With AIDS prevention, we give a 6-session course so people really know this is serious. And there is a significant increase in condom use and avoiding HIV. And with the kids mentoring, we train older teens to be mentors for younger children whose parents are sick. Some of the kids are orphaned. And to see the teens take this responsibility and do such a great job with the younger children and giving them, security and attention, it's wonderful.
I love these kids. I love my mentors. I love just being a part of Help People. I definitely feel like I'm changing lives of kids, because there's a lot of kids in this world that lost a lot of people, lost a lot of things. Some kids are dropping out of school. Some kids is not making the right decisions. But I was in that position when I lost my mother. I thought that my life was over. I thought I had nothing left. But then I realized that as long as I keep doing what I'm doing, then I can be able to make a difference, and they can make a difference as long as they believe in themselves.
The health professions, as they begin to understand how best to deal with chronic disease, is embracing self-management and the power that peers have in helping people manage chronic illness, and that's the future of managing chronic disease.
I'd like to see the Children's Mentoring Program become a model nationwide, which doesn't mean that we want to run it, but we'd like to help other people replicate it. There's so many kids in the United States who have sick parents, who've been orphaned by AIDS. They need this kind of mentoring in their own community. And the other thing I'd like to do is look at how you can concentrate this kind of education. For example, go into a large building, go floor to floor, door to door. Who's sick? Okay, we'll educate you with this. Who has prediabetes? If they're educated now, the chances that they will get diabetes in the future are so much less. And just do it that really localized and powerfully, so then people can naturally start working with their own neighbors to improve the health in their immediate surroundings. There's an old saying, dig where you stand and you surely will find a well. If you want communities to improve their health, then you have to trust to them and educate them.
Knowledge is power when battling disease and health issues. Learn more about how Health People teaches those battling illness to take control of their own health. For more information or to donate, go to healthpeople.org.